Snoring is a very common condition today. It affects almost half of men and a third of women. Snoring is created when, as someone falls asleep, the muscles in the neck relax and soft tissue tends to collapse into the airway. Vibration of this soft tissue causes snoring. Frank obstruction and collapse of tissue can lead to sleep apnea. And in some cases, it can be important to do a sleep study to make sure that someone doesn't have sleep apnea. That being said, there are a number of successful and potential treatment options for snoring. Weight loss can help just about anyone with snoring. Positional sleep, not sleeping on someone's back, can be very beneficial. And for patients that do have sleep apnea, sleeping with CPAP at night can introduce a column of airflow in the airway to prevent collapse and vibration of soft tissue. Then we have a number of different procedures that can also help. Nasal surgery to improve nasal airflow is beneficial. There are surgeries in the mouth and procedures in the mouth that can stiffen or remove soft tissue to improve airflow, can all be meaningful, give meaningful improvements. Something as simple as a dental device that is like a mouthpiece that someone wears at night can stabilize the lower jaw and keep the tongue from collapsing back in the airway. That can be a meaningful treatment. Fortunately, we have a number of different options. Every patient is different. Patients have different treatment desires and goals. Some things are attractive for some and not for others. Visiting an otolaryngologist who specializes in the treatment of sleep and sleep disorders can be very beneficial for someone suffering from snoring. Thank you for visiting enthealth.org. Please use this site as a trusted resource for accurate medical information. And please click on Find an ENT button to locate a local otolaryngologist in your community.